Hello, this is Dr. Jerry Cuomo, and welcome back to the rescue case of a Biomet 3i certain implant screw. It's a screw fragment. We're now showing you the video of the access site surgically exposed, and conservatively I may add, because we went in with a small scalpel. I think it was a 15 blade scalpel, just went around the rim and left all the peripheral tissues so that the blood supply continues to nurse uh, the top of the implant and the bone surrounding bone itself. So I had to place retraction cord between the rim, of the top of the or the occlusal portion of the implant and that of the soft tissue. So that's holding any oozing back of any excess of blood. Now I'm taking just a blunt end instrument, nothing to push too hard against the implant. I'm just trying to push back the soft tissue. Within the implant body fixture itself is cotton left by the previous dentist to protect the fragment internally. So that was a very good uh, thing to do to protect the threads, internal threads, and not only that, but the believe the 30-degree um, internal hex that's available. All these, it's 12 different ways to turn the abutment, and then there's a 6-sided hex internally. So it's like a chamber that's made up of various interlocking segments. So now what you're seeing is basically the head of the fragmented screw. On the right, the shiny portion is the first part of the thread that's torn, and it's part of the screw, not part of the implant fixture itself. And so that is that's facing me. The other thing is I'm in there with placing tartar and stain remover, so it's a solvent that can go in and penetrate. It's clear right now, so we'd like to see it turn a cloudy consistency, so you can see if it is cloudy, then we know it's penetrating and it's starting to work on the bioburden that's in there, including calculus, mineral deposits, and even blood. So all of the above. You could see there was a prior mark on the top of the screw, probably because of an instrument, a dental instrument, from the learning about this broken screw was touched in that area. But the patient reassured me that the dentist didn't go in and use any excessive force. He just visualized it, saw it, decided to just put some cotton in there, and closed it up. So patients coming in with a very good positive attitude that hopefully everything is going to be fine, and is consented to have this type of treatment done. So my treatment protocol, along with that of 3i's, is basically to use no rotary instruments whatsoever. They do have a screw retrieval kit, which I have on hand. So if I cannot get it out by just simple measure of using a suction tip, a blunt end suction tip, which is about a 20 gauge diameter, then I would be forced to use their retrieval kit. So again, good people at 3i that have been online and over the phone with me to coach me through anything that I would need. And it's good to call the implant company and to discuss the case prior. The videos also will be available for the company for review and also for logging in the case. So we're just waiting patiently. I always say, trust your brain so much as to not your eyes. You have to think that by waiting, we're allowing that solution to penetrate. And as I've done in the past with other cases that you've seen on the internet, patience is important, and just waiting. So using a dental microscope is so important. I can't express the need to use that with this procedure. Just using dental loops is okay, but it's not as advanced, where we can actually see more depth. Now I'm just going back and forth with the magnification. We are going to go to another video segment soon, so this is Dr. Jerry Cuomo. Well, let's see what happens when we go back in there with this case, with our suction. Hopefully we can get this screw to come loose and be on our way. Take care.